Imagine a small, silent factory deep inside your upper belly. It never makes any noise. You never feel it working, but every time you eat something, pizza, dal, salad, dessert, this factory wakes up, does its job, and then goes quiet again. That hidden factory is your pancreas. And pancreatitis is what happens when that factory catches fire from the inside. The pancreas sits behind your stomach, close to your spine. It has two big jobs. First, it acts like a kitchen. It produces powerful digestive juices, enzymes that can break down fat, protein, and carbs. These juices normally travel through a small pipe, called the pancreatic duct, and empty into your small intestine, where food is waiting. Second, it acts like a control room for sugar. It makes hormones like insulin and glucagon that keep your blood sugar in balance all day long. When it works well, you don't even notice it exists. You just digest food, absorb nutrients, and feel normal. Now imagine this. The factory starts preparing its powerful tools, the digestive enzymes. Normally, those tools stay locked and inactive until they reach the intestine, like knives wrapped safely in cloth. But in pancreatitis, something goes wrong. These enzymes become active too early. Inside the pancreas itself, the knives come out inside the factory. Instead of digesting food in the intestine, they start digesting the pancreas. The body reacts the only way it knows: inflammation, swelling, pain, and a whole chain reaction of chemical signals. That is pancreatitis, inflammation of the pancreas, because its own digestive juices turned against it. Acute pancreatitis is like a sudden fire in the kitchen. One day, a person wakes up with severe pain in the upper abdomen. It may feel like it drills straight through to the back. It often gets worse after eating. They may feel nauseated, start vomiting, break into a sweat. In many cases, doctors find two main culprits behind this sudden fire: gallstones, tiny stones from the gallbladder that can slip down and block the common channel where bile and pancreatic juice flow; alcohol. Heavy or repeated alcohol use can make pancreatic cells more vulnerable. It can change the flow and character of the juices, promote little plugs in the ducts, and trigger inflammation after a binge or after years of irritation. There are other causes too: very high triglycerides, certain medicines, high calcium levels, trauma, infections, and sometimes no clear cause is found at all. But the final common pathway is similar. Enzymes activate inside, tissue gets injured, and inflammation explodes. At first, the damage is local: swelling, fluid, and irritation in and around the pancreas. But the pancreas is not just any organ. When it becomes inflamed, it can release a storm of inflammatory chemicals into the bloodstream. Now the fire alarm rings throughout the whole building, the entire body. Blood vessels widen, then lose tone. The lungs may fill with fluid. The kidneys may struggle. Other organs can get stressed or start to fail. That's why severe acute pancreatitis is not just a stomach problem. It can become a whole body emergency, needing hospital care, IV fluids, pain control, close monitoring, and sometimes ICU support. There is no magic pill that instantly turns pancreatitis off. Instead, doctors focus on supporting the body while the pancreas heals, resting the gut at first, then gently restarting nutrition, giving IV fluids to support circulation, relieving pain, watching for complications like infection or organ failure, removing the trigger when possible, like treating gallstones or advising strong alcohol cessation. In many mild cases, the fire calms down within a few days. The factory is bruised, but it recovers. In severe cases, parts of the pancreas can actually die, necrosis. Fluid collections may form. These situations may need drainage, procedures, or surgery, and careful expert-level management. Now imagine a different story. Instead of one big fire, the pancreas experiences small, repeated fires over months or years. Each time, a little more tissue is damaged. Scar tissue forms, ducts become irregular or blocked. Nerves in and around the pancreas get irritated. This is chronic pancreatitis, a long-term progressive inflammation. It doesn't just come and go, it reshapes the organ. The person may have recurrent or constant upper abdominal pain, pain that worsens with meals, gradual weight loss, oily, difficult to flush stools because fat isn't digested well, and over time, difficulty controlling blood sugar. The enzyme-making cells get damaged, the person can't digest food properly. The insulin-producing cells get damaged, diabetes can develop. The factory is no longer just inflamed. Parts of it are permanently broken. Chronic pancreatitis is often linked to long-term heavy alcohol use, smoking, genetic factors, obstruction of the pancreatic duct, or it may follow repeated episodes of acute pancreatitis. The pain can be exhausting. People may be afraid to eat because eating triggers pain. They may become underweight, anxious, or depressed. So chronic pancreatitis is not just a structural disease. It affects nutrition, hormones, mental health, and quality of life. If the pancreas is a quiet factory, then what does it need from us? Respect its limits with alcohol. Repeated heavy drinking is one of the biggest controllable risks for pancreatitis. Don't ignore severe upper abdominal pain, especially if it radiates to the back or brings vomiting and fever. Seek care, manage gallstones, high triglycerides, and other risks under medical care. So remember the image: a quiet factory, knives that must stay wrapped, and the fire that begins when they turn inward. Sometimes the blaze is sudden and intense, acute pancreatitis. Sometimes it's a slow, relentless burn, chronic pancreatitis. Behind the terms and scans is a simple story. An organ meant to help you digest food accidentally starts to digest itself. This video is for education only and is not a substitute for professional medical advice. If someone has symptoms that sound like pancreatitis, they should seek medical care immediately.